Hello, Anne Marie and Elaine. This is Rosa Campson, and I'm here to present the recommended chart and forms. Um, Before I get started, I'd like to say that I'm really pleased and happy and proud of what you are doing in Cameroon. It's absolutely wonderful. And if I can assist you in any way, please do not hesitate to contact me. Before I get into the forms, I'd like to say a few other things. And I have my notes here, so I will stay on track here. I'd like to say that the forms were developed keeping in mind the prevalent diseases in Cameroon because the forms should be relevant and applicable to the types of things, diseases, injuries, illnesses that you will see in Cameroon. So I just wanted to let you know that. And the second thing I wanted to let you know is that Cameroon is in real need of a national health database system. I am aware that Cameroon is incorporated into the World Health Organization's health database system. However, it's my belief that this database system is not truly reflective of what is happening in Cameroon. Data is frequently outdated, and here again, I'm not sure it's on, well, I'm pretty sure that it's not on target. I'm also aware that there's another organization which incorporates Cameroon's health statistics in the database system, and that organization is CCGHR. You're probably familiar with these. But here again, my opinion of that database system is the same as it is with the World Health Organization. So here again, Cameroon really needs a system, and I just wanted to kind of express my opinion on that topic. And next, I would like to just share some information with you. In Cameroon, there has been some real changes in terms of technology, mobile communication. There is a mobile communication corporation out of South Africa. It is MTN, and they have actually penetrated deep within Cameroon, and they are now covering a large number of the villages there. So in many of the villages, there is a means for number one, communication. And when you have communication, you have the ability to utilize an electronic system. So I mention this to you because it may be very possible for you to develop an electronic system using the linkages through these mobile applications, which here again have penetrated deeply into Cameroon villages. And with such a system, the data can be collected from the charts manually and then uploaded through the phone mobile system into another location, into the electronic system, which would then allow you to manipulate the data to analyze it. Also, it would allow in the future, if Cameroon does get a national database, to tap directly or send your information directly to that database so it can be reflected in the overall statistics. So I just wanted to mention that to you for something to keep in mind for the future. I know you want a paper system, and I have developed that per your request. So now I'll just go ahead and start talking about the forms. Each of the forms are numbered. Each form has a number at the bottom of the right-hand side, and this number allows for an organized manner in which to collect the data, and then it also allows for a more efficient way to collect the data if you know what form to go to for the information you're looking for. And then it also allows for more efficient communication in terms of sharing information from one form to other individuals. So just want to let you know that. And with that, let's get started. This is form 001. It is the adult history form. As you can see at the top, there's an area for physician name, the location / village, and the date. Then there's an area for patient information. And below that, you have a variety of different things to check off in terms of the patient's history, medical history, things such as bleeding disorders, sickle cell anemia, fatigue, and the like. If you would like to look at each one of the items listed, please click on pause right now so you can look a little bit closer. This is page 2 of form 001. As you can note, there are additional symptoms to be checked off, as well as there is a section in the middle there for medication and reason for the medication. And there is an area below that for blood pressure for vital signs. And below that, there's an area to record any allergies. This is page 3 of form 001. This is a graphic display of the body so that the examiner can make notes or circle any areas where there is a concern. This is form 002. This is an adult vaccination and TB tracker. As you know, tuberculosis is a prevalent disease, and it is significantly increasing in Africa and Cameroon. There is information on the form for patient information. There, below that, there's a section for recording the name of the vaccine, the date it was given, who it was manufactured by, the lot number, the site where it was given, the name of the vaccine, any allergies that were noted, signature of the person giving the vaccine, and a spot for the patient to sign. And below that, you have the vaccination record to note all of the tests that had been given in the past. Form 003 is an Amsler grid eye test for macular degeneration. Form 004 is a body pain indicator chart to note any area of the body where the patient is experiencing pain. We now have form 005. It is the growth tracker chart, and this is for children. There's an area to put the patient information, birthday, gender. Below that is an area where the growth rate can be charted along with height. Also, I'd like to mention at this point that if you would like to look at the form further, just press pause and you can examine the form more closely. Next, we have form 006. This is a breast self-examination record. I would recommend that this be incorporated in the chart as well. It provides for regular examinations with the date, any problems, space for notes. And at the bottom there's a area where any abnormalities can be noted, such as discharge from the nipples, any lumps or redness, or the like. And I would like to say that although statistics reflect that African women have less breast cancer than in the West, we should note that the cases that are in Africa are usually very severe, and many are terminal. Having said that, because of the statistical collection of information, or the collection of statistics in Africa is not reliable, we really don't know for sure what's happening in terms of breast cancer with African women, because in my opinion, the statistics are just not reliable. So this is an area that, even though statistics reflect there's not a problem, we really need to pay close attention to it. This is Form 007. This is a child immunization record. As you see, you could put the child's information along with who gave the immunization, the date, age, the vaccine given, who it was given by, when the next dosage is due, and then there's an area for notes. This is Form 008. This is an APGAR newborn scoring chart for documentation of the condition of the infant upon birth, things such as muscle tone, heart rate, skin color, respiration. It's pretty straightforward. Next, we have Form 009. It's a gestational age calculator to help determine the number of weeks pregnant the woman is. This is Form 011. This is the perinatal obstetric form. At the top, you'll notice that there's a place for patient information and location, the village. Also, there's detailed information that will be collected regarding the menstrual cycle. There is also a space for listing all pregnancies, and also listing any conditions experienced during pregnancy. This is page 2 of Form 011, the obstetric form, and this is the side of the form. This is a two-side form. The total length of this form is 9 pages. This is page 2. This page 2 collects information in regards to the history of any past pregnancies, as well as any other history, general history of the woman in terms of her weight, any physical limitations, any dental conditions, whether or not she has issues with her hearing, as well as if she's had a history of strep throat. Here again, pause to look at the form closer. This is page 3 of Form 011. This form records the assessment of the woman's lymphatic system, heart, urinary, and in addition ascertains more information in terms of other diseases that she may have, such as sickle cell anemia, or any other types of diseases. You will also note that HIV is also included on this form, on this page. This is page 4 of Form 011. It's a continuation of collection of information from the patient regarding her medical history. It covers such things as musculoskeletal, neuropsychiatric issues, gynecological issues. Please press pause to look at each of the items very closely, because there's a lot to this page. This is page 5. The form goes into further detail regarding childhood illnesses. And here again, this is Form 001, page 5. Also documents any surgical procedures and family history. Page 6 is a continuation. Page 7 of Form 011 is a psychological assessment. It's pretty straightforward. Page 8 is a nutritional assessment. This is page 8 of Form 011. This is an assessment of the woman's nutritional status. And this is page 9 of Form 011. This records the findings during the actual physical examination. Next, we have a 3-page pediatric physical examination form. At the top, you notice that there is a area to collect the patient's information, including name, date of birth, last visit, allergies. There's also an area to collect immunization status at the time of visit, record the vaccinations. At the bottom, there's an area where you can document developmental testing results, vision results, hearing results, etc., and an area for lab work at the bottom of that page. Page 2 of Form 014 is information that can be documented regarding any symptoms that the child is experiencing, and there are a number of different choices to select from for the physician to document. If you would like to look at each one of the items, please click on pause. And finally, we have page 3 of Form 014, and there's a space here for the physician or examiner to record additional notes. Here we have Form 012. This is a nursing care plan form. It's pretty self-explanatory. Page 2 of the nursing care plan. Next, we have Form 015. It's a prostate exam log. It's pretty straightforward, offering the age, examination date, PSA results, digital rectum results, and when the next exam is due. Form 016, physician progress notes, pretty straightforward. And it is a 2-sided form. I will show you the second side. This is Form 017, surgical history record, recording date of procedure, the surgeon, description of the surgery, rehabilitation, and any medication prescribed. A small area in the bottom for notes. On the back, page 2, there, the entire page is dedicated for the physician to add additional notes. This is page 2 of Form 017. There is ample space for additional notes. This is Form 022. This is a gynecological exam form. At the top, there's an area for the name, the birth date, and the location / village. And there's a lot of information collected on this form, page 1, such as high blood pressure, diabetes, urinary tract infection, varicose veins, vaginal bleeding, and the like. Please press on pause to look at the form closely because there's a lot to see there. This is page 2 of the gynecological exam form, and page 2 continues with areas that the physician and can cover with the patient, including various venereal diseases, also whether or not there are any tenderness observed upon the vaginal examination, hemorrhoids, and the like. Please pause to take a closer look. There's a lot there to look at. This is page 3 of Form 022, the gynecological exam. There's an area at the bottom there that the physician or examiner can include additional notes. Form 019 is a TB test results form. This is Form 020. This is a family medical history form, and it collects medical histories of the family members of the patient. This is Form 021. This is a well child pediatric physical exam form for children who are just in for their routine checkup. It covers a number of areas, whether they're well nourished, if they're developing well, assess their skin and hair, ears, eyes, nose, mouth, heart, abdomen. It is a 2-page form, and I will show you the second page. Page 2 offers the examiner the opportunity to record their assessment and their primary diagnosis, the plan for the visit, any additional notes for that, educational plan, and any referrals that are needed. This is Form 013, the infant assessment plan. It evaluates the baby's progression in terms of sleeping, eating, evaluates whether the baby can hear, and if the baby looks at adults' faces. It evaluates development, socio-emotional, and other areas. Please press pause to take a look closer. This is page 2 of Form 013. It provides an area for a physical assessment and a plan to be developed for the infant. Form 018 are the SOAP progress notes. Page 2 of the SOAP notes. Now I would like to show you the chart that I'm recommending. It is a very simple chart, and it is not assembled as of yet. I will be assembling it and showing it to you later. Now this is the front of the chart, and you could place a label here with the name of your organization there. For purposes of this video, I just made a mock label. This is the very front, and as you can see, it is 2 holes at the top, and this is where you insert the metal inserts to keep the entire chart together. I will be showing you that as well. And the chart has various tabs at the bottom, as you can see. Okay. And the first tab, you can put your history and physical. There's also a tab for your lab and x-ray. There is a tab for any procedures that is done. There is a tab for follow-up and lab and x-ray, as I think I may have mentioned that, and a tab for miscellaneous. So this is the chart that I'm recommending. Here again, it is very simple, and I will come back and show you the entire chart assembled with the various forms inside so that you can take a look and see what it's going to look like. This is one of the most inexpensive chart forms on the market, and I thought that with limited resources, it will probably be a good choice because it is a functional chart for you to use. In terms of purchasing the charts, there are a couple of recommendations that I would make. One recommendation, which I highly recommend, is to go to the purchasing department of the hospital that you're on staff at and speak to the director of the department and tell her about what it is you're doing and that you are in process of developing a chart system, and ask if she would be willing to, number one, connect you with the vendor that provides them with their forms to arrange for you to talk to them, and number two, ask her if she would support your request to that particular form vendor to provide these charts to you free of charge. The vendor that the hospital works with is for-profit, and they're always looking for ways to do write-offs, so there's a good probability that they would do these charts for you free. If not, then I would ask for a deep discount in terms of purchasing these chart forms. This is pretty standard. Most medical forms companies have this particular chart. So ask for a deep discount, and you may want to find out what the discount is that the hospital is getting, and ask for that as a minimum if that is the option that is presented to you. But first of all, I would, request for the charts to be donated free to Village to Village, and take it from there. As promised, I have the assembled medical records chart, the recommended chart, and as you can see, it's a very simple chart. Please note that I did include a mock label. You can have some labels printed that will go on the front of the chart, or even better yet, you can ask the vendor who supplies you with the chart form or chart to print the name of Village to Village on front. Here at the bottom, there are the various tabs, and I put the forms into the various under the various topics that the labels here indicate. Please note that I was sent a very limited number of these little tabs, but they have a whole host of different tabs, different areas that you can include in this chart. So, but this is the chart. With the forms. Okay. And I do believe that concludes this project. I hope that you find this chart and the forms to your liking. And here again, if there are any changes that you would like to incorporate, please contact me. I would be more than happy to make those changes. And here again, I'm just so excited to be able to contribute and to help in this endeavor. I really admire what you all are doing. It's wonderful. Have a blessed evening. Oh, one other thing. Tomorrow I will be putting this assembled chart with all of the forms in the mail to you, to your attention, Anne Marie. And I will also email between tonight and tomorrow afternoon all of the files to you so that you would have the files and be able to look at the files, make changes, whatever you'd like to do. I would like you to have those files in your possession as well. And with that, that's it. It's been wonderful. Bye-bye.